Hi everybody, can you all hear me up the back? I have a very loud voice, I'm sure you can. Colin Cochran, I'm the agent for Lunula Lasers. The company's called Erconia and based in Sydney. They do a lot of other products too, which we'll show. Now I've handed out a brochure. You can leave that till last. It just goes through a few things, a bit more detail about the laser, and obviously they're trying to sell other products, so there's some other stuff in there too if you're vaguely interested. So I think probably the best way, I'll just introduce myself, I won't bore you. Basically I've got a nursing background about 300 years ago, just after the war, as I say. As you can see, I'm just an old fart, that's what I say, anyway. And then I trained here, and then I specialised in emergency nursing in the UK, Leicester Royal Infirmary, which is a wonderful experience. Then I taught postgrad in emergency and related to the University of London. I got a degree from there, physiology. Then I taught there for 3.5 years, and then I worked offshore for 5 years as medic in charge. And then I came back here, got into, lectured at Edith Cowan, and then got into sales. So I'm trying to retire, but these things just keep coming back to me. Okay, so the laser. I was the agent for the laser. Reha is the company in Sydney for some years. A number of years ago, about 3 years ago, I think, from memory. And I left because I was doing some other stuff, and it became a bit, I was quite busy. And I've just started doing the laser again. I think we've sold 6 or 7 in WA. I sold most in the metro area. I won't name where they are because obviously, you know, you don't want anybody who's involved doesn't want competition, so I won't name names or suburbs. One in Albany, I believe. I think it's the only country area. So that's kind of it really. And in Australia we've sold, I think we've sold 4 since the beginning of the year, so 4 since January, which is not bad. And there's a total of about 85 or thereabouts in Australia and New Zealand. So, you know, they're becoming more popular. And I guess the unique thing about it, I'll go through it in more detail, the unique thing about it is that it's a cold laser, very low intensity laser. There's two rotating lasers in there which I'll demonstrate to you later. And the patient literally sits on a chair, this is on the floor obviously, and pops their foot in. So that's it. So there's no, anybody here use the hot lasers? Nobody does? You do? Okay. So the hot laser is the traditional one, and they work, you know, reasonably well. But obviously, it's an individual thing where you do mainly the helix, of course, and you do individual dots. Whereas this one, you pop it in, can do the 5 nails if necessary, or more than 1 nail, and lasts for 12 minutes, then it turns itself off. So you could theoretically pop the patient's foot in there, leave it go and do, I'd see other patients will do other things. So it's not actually a physical individual, you're having to stay there and do it. There is a recommendation for debridement on the very first visit, but we'll discuss that later. Anyway, we'll go through the presentation then. So there's always a very attractive young lady with lots of hair. Now this is a presentation, I'm not jealous, honestly. I haven't had hair for so long it doesn't worry. All I can say is I've saved a lot on hairdressers and shampoo and conditioner. Thousands. My wife's got the most magnificent long black hair, so she makes up for it though. This is a presentation from Martine Abrams, and this is what you can think about in terms of, she's based in London, the London Nail Laser Clinic. And she's obviously originally a podiatrist and got further qualifications. And I've heard her speak a number of times. She's very cluey. Now she's a podiatrist, as far as I'm aware, only does laser therapy. She doesn't do any other podiatry. Not that I'm aware of anyway. So that's all she does. I think she's got a number of clinics. I think one's in Cheltenham and one's somewhere in further central London, or closer to central London. And her entire practice is these lasers. That's what she does. She may do other stuff, I'm not sure, but basically that's it. It's called the laser clinic. And she has quite a number of lasers. I think she's got 12 or something. So that's just not suggesting that you guys will probably ever get there if you ever decide to go into this, but you know, it obviously works if somebody does it exclusively. We've got other groups. My Foot Doctor, for example, they've got a number over east, and I think they bought into here now. So there are groups who repurchase lasers. So you know, which always to me says, you know, they obviously work if they're purchasing more. Right, Erconia, just very quickly, I won't bore you with any more than I already have, but they're a US company, privately owned, and they specialise in lasers. And this is just one, this is for back pain, and they do other things for various other types. So they specialise in lasers. They're not a big medical company who does a whole bunch of stuff, so they specialise in lasers. And this laser, Lunula, is the only one, I believe, of the... It's a unique laser, and it's called, but it's the only laser that has FDA approval. So it's been approved by the FDA, which, as you know, is quite a milestone in company. Right. So people say, okay, if you buy one, do you need to redo your practice and get, you know, laser signs and all that sort of stuff? No, you don't. It's classified as by the TGA as a Class 2 device, and therefore, it is not of any danger. Patients or yourself don't have to wear goggles, anything like that. So it's a low-level laser. Dual diode rotating collimated. You'll actually see it when I turn it on. I'll do that towards the end because that's the sort of star bit of it. Monochromic coherent beam. Now it has two wavelengths, and this is I think the unique part of it, 405 nanometers, which is a violet colour, and you'll see that, and 635, which is a red colour. And they worked out that the two in combination, you know, give a good result. Very low intensity and dosage, so it's not dangerous. Basically, obviously you wouldn't get down on your hands and knees and put your face in there and, you know, potentially damage your eyes, but other than that, there's no. And this is just the light spectrum. My physics is not that good. It probably used to be, but it's not that good. But it's in that visible light spectrum. That's where both wavelengths are. So low-level laser therapy, photobiomodulation is used to stimulate healing. Lunula uses two different diodes, violet, 405, and that's sort of antimicrobial, so it has two different effects. And the red beam is for healing, and we'll explain a little bit more about that in a moment. The light is absorbed by melanin, obviously colours the skin, hemoglobin, oxyhemoglobin and water, so it's actually absorbed quite well. And this is the physiology part, the cytochrome C it stimulates. And that's in the mitochondria of cells. Remember the powerhouse of the cells. I'm sure you know all this, so I won't bore you with it. And the light is absorbed by photoreceptors and production of certain chemicals which help heal. So there is a lot of science behind it. Okay, and this is in a little bit more detail. And again, this is fairly advanced, and I must admit my physiology was okay once, but it's not super good these days. But basically, you've probably heard of how does it work. So reactive oxygen species converts to hydrogen peroxide, and as we all know, hydrogen peroxide, and I'm sure you've used it at some stage in your practices, it's, oh, how did that happen? I hit the wrong button, my apologies. Okay, I'll put that down, actually, more dangerous than my... hydrogen peroxide, and hydrogen peroxide, of course, is being used traditionally in hospitals as a antibacterial, fungal agent, and it helps increase the production of hydrogen peroxide. And then ATP, we all know that's the power from the powerhouse of the cell, from the mitochondria, and that's converted to nitric oxide. Nitric oxide, if you're not familiar with hospitals, but in ICU, they give nitric oxide regularly to patients who are really, really sick, and that helps dilate blood vessels. That's one of the functions of it. So you can see from that the two forms of the way it works. And again, looking at that, so It's a photochemical reaction from light, photoreceptors, nitric oxide, cytochrome C oxidase, etc., and then reactive oxygen species, ATP, etc. So that goes in. So two things that happen: you get hydrogen peroxide and you get nitric oxide. So that's kind of how it works. Now that's right. Now I've got a little video which is explaining it much better. There's no is there anybody? I don't know how the video. Yeah, there's nothing on the. Oh, okay. Just have to. Yeah, it had a start.
It's not my computer, but I can get Karen to try and come in.
Oh, that'll be if you can get it started there. Yeah, it did. Karen said it did well. Wait, it's just loading the looks of it.
Let's just see.
This is a little video of basically how it works. So.
Let's see if this will work this way. Sorry.
That's all right. Yeah, Karen mentioned it did work, so.
Apologies. Nope.
No, that's why it's back here. That one. That's the boy. That's it. Thank you. And it's even got nice music, so. Bit of romance. That was okay. It's all right. Yeah, I think we should turn the volume down a little bit. Oh, this is the wrong one. No, this is not right. No, it's not. It's the wrong one. Sorry guys, it's obviously the wrong, I don't know how that happened, but the music was okay, and they do fat lasers as well, so anyway, trust me, it's a good, I'll try and get it on, but so Econia itself just goes through what's in the company. They're a very professional company, as I say, FDA approved, so that says something. Quick history. Okay. 96 they started. 2002 FDA approval for this low level laser. So it's been nearly 20 years. And then they do various other types of lasers, which we won't go into detail, but that one was for fat. I don't know how that got on there actually. It certainly wasn't, but anyway, if you want to lose some weight, and it goes through, and they do and for back pain and etc. So I won't go through that in 2018. We seem to have, okay, how does it work? Yeah, sorry, we've got mucked up a bit here. That was the wrong video, obviously. Yeah, this is the video. This is it. Yeah, you recognise that? It's a toe. No music, just.
Shock and awe.
As we've been through before. Obviously, blood flow to the toenails or to the toes is very important. Stimulates the immune system. rotating beams. I think that's it. Sorry about prior. I don't quite know how that was loaded on there. But, okay, 635 nanometers, the wavelength, blood flow, and this is just a Doppler representation before and after. The anatomy, which you all know very well, obviously, just increased blood flow, destruction by nitric oxide. Okay, onychomycosis, obviously tinea, wound healing. There was actually a foot and ankle surgeon who's purchased one. She initially got it for fungal toenail, but now does use it for wound healing post-op. And she said the results are quite good.
Is there any research on that?
Research on wound healing? I would have to check. It's, you know, they've got research on most of this stuff, so I'll check. Just come and see me and we'll organise it. Slow growing nails and obviously improving circulation. And again, Karen was saying she works in the diabetic clinic, I believe. So, you know, obviously that's a huge problem. The circulation in diabetics, as we all know, is very poor. So not that it's going to treat diabetic ulcers perhaps, but it may help. So if the diabetic's got poor toenails, it may help. No. Psoriatic nails, you're all familiar with psoriatic nails, I'm sure, okay. They get psoriasis is a very difficult to treat skin condition. No specific, there are various types of treatments, but again they do get psoriatic nails and they get psoriatic arthritis as well. So this it may be something that you know, if you're looking at, you could consider that. Damaged nails and complications of diabetes, neuropathy, and vascular disease. Do all of you treat diabetic patients? I guess you all know this. Yeah. And again, it's not going to be curing things, but it certainly may help. So the most common, as you all know, I'm sure, constitutes about half of the nail problems that you'll see. And actually interesting, I'll show you some slides in a minute of fingernails. Now I believe legally you guys can't treat fingernails, I believe. So
if they're from the United Kingdom, they can.
What's that?
If they're from the United Kingdom and
Yeah.
they can, but if they're not, they can't.
Okay, yeah, because Martine Abrahams in the London clinic, she does. So there's a different. So anyway, yes.
I was going to say the clinic I work at has a laser, and we've contacted our insurance providers, and they've given us permission.
Oh, really?
Yeah, so we have done it on a couple of it.
Yeah.
But we haven't been able to do it.
Yeah. Well, they.
Can I talk to you after?
Insurance companies don't make laws.
Let's not get political, guys. I don't want to fight. Anyway, it's something you know. I'm not saying break laws or do anything, but it's something you certainly can consider, which opens up your practice a little more. So if someone comes in, they've got a toenail and just happen to have, I don't know. I can't comment, but so 10% of the adult population. I'm sure even some of us amongst this, there's 10% of us got some sort of nail problem. And the single most difficult problem to treat. Do you find that? Do you find it's one of the most difficult?
Yeah. Psoriatic nails is difficult, yeah.
Okay, so treatment options, you all know these. I again won't go through it in detail, but the various home remedies. And on the internet, of course, you see stuff all the time of various products and little pieces of equipment and whatever. Topical preparations, daily lacquer. There's actually one of the case studies who use lacquer, and it has caused problems. And I've found, I don't know what you guys have found, but since these nail clinics have sprung up everywhere, the nail cosmetic ones, there's a lot more problems. In fact, a close family member got a really nasty infection. And again, I'm not knocking those people, you know, that they're doing their job, but there's a lot of them about now. So whether your client base has increased or could increase is potential.
It increases
Yeah.
exponentially.
Exponentially, okay, that's good. So again, and I'm sure fungal toenails will be one of the major problems. So topical preparation, they don't tend to have a lot of success, and again, you guys are much more experienced than me. Now, systemic medications, which are prescribed by GPs, and again, I don't know if these are Australian trade names, Lamisil, Sporanox. Yeah. So this is an English presentation, obviously, but anyway, and you take them orally. They say there's about a 50% success rate. It tends to come back, I believe, if you stop taking them. And the main thing is it can stress the liver quite significantly, and there has been some cases where the liver is affected. And because of that, you may not be able to repeat the drug therapy if LFTs go up the spout or whatever. And it's a single agent is not always effective against a multitude or perhaps various fungi. Surgery. I've done quite a lot of this myself, actually. Especially when I was offshore, I used to do whatever I wanted. And localised and take nails off, remove nails, and even do I don't know if you're familiar with Zardex procedures, which they scrape the nail bread. Some of these guys. I used to do also. I used to. Yeah, very old. He's out. No afternoon tea for him. You're suggesting they don't do Zardex anymore?
Well, not in the Western world.
Okay. No, they do. Well, I would have to argue with that. They may not call it a Zardex, but they still remove nail beds.
The Zardex was a brutal thing.
Yeah, it is. Yeah, they scrape the nail bed out anyway. Anyway, I have done quite a lot of this stuff, so I kind of half know what I'm talking about. And then thermal lasers, some of you use, and I'm sure you might find it you're happy with it. And it certainly is, from my just anecdotal, I've heard people have had it and they say it's very uncomfortable quite often, and it does take, from your perspective, a fair bit of time.
It is when you blow the toe out.
What's that?
It is when you blow the toe out
Yeah,
with the hot laser.
yeah. So, again, that's, and I think they're probably about half the price of this. I'm not sure exactly, the good ones anyway. So you can get cheap ones, but I have heard people who've said that. And so, it's not a particularly pleasant experience, whereas with this one, as you'll see, there's no problem, thermal. Now, just in terms of the surgical side, I also, one of the jobs I had for about 5 years, I was the agent, and we sold foot and ankle implants. Okay, so anything from ankle replacements, a lot of bunion work, your screws, and I know, even though I haven't done it for a while, I know most of the foot and ankle guys pretty well. Okay, there is one particular foot and ankle guy who asks me all the time, "Have you got a podiatrist who uses this laser?" And I'm not pushing. This is what he's said to me. He said, "Because I've got patients asking for it." So if anybody is interested, and particularly in the southern suburbs, I could certainly get you some references. So he's desperate, and in fact his PA contacted me again on Friday, and I had to send a list of where he works at Murdoch's. There's a lot in the southern suburbs. Okay, so that's just something, and that's not a bad way to practice actually, in terms of if you're looking, if you go to these guys, because they get them all the time, obviously with various foot, bunions or whatever, and patients have them, they say. And that's another thing too with, my wife actually she's a rep and does robotic knee surgery. Works for a company called Smith & Nephew. And it's interesting how patients are asking now, ringing up the practice, not all of them, but some of them, and say, "Do you do robotic knee surgery?" Because they want the latest and the greatest. And there's no evidence that robotic knee surgery gives you a better result thus far. They've done studies on it, even guys who use it say, but they want it. And the other thing is minimally invasive surgery, which are minimally invasive bunions. I'm not sure if you've seen any results of those. So instead of the big procedure, scarf osteotomy, which I'm sure you've seen the big scars, patients are, so it's basically a couple of holes and there's burrs and they burr it away and the patients recover better. And it looks horrible on X-ray, the results, but the patients like it, and minimally. And patients are now actually ringing up and asking for minimally invasive surgery. So my point being is, I think in the future you're going to find that people, they'll see something on TV about this or some other, and they'll say, "Oh, do you do minimally invasive surgery? Or do you use that laser?" And this is something which, from a marketing perspective, might be worth keeping in mind. Now, the need for new options. Okay, we know what the options are now, and you all treat them. You're much more expert than I am, as I keep saying, obviously. But the beauty of this, I guess, is that it's unique. There's nothing else like it. There's quite a number of thermal lasers around, and the brands. There's some very cheap ones, which are probably fairly nasty, and there are some more expensive ones, from good companies, and they probably do the job reasonably well. I'm not knocking them, but there's nothing like this. You ain't gonna. There's no other company that does this cold laser, and minimally invasive with basically no side effects. And some of you, if you want, at the end of this, we'll have 10 minutes or so, and then perhaps at afternoon tea, if you want to put your foot in there and feel it, you can. Okay, so home remedies and topical solutions. Okay, there's millions of them, and sometimes they work a little, sometimes they don't. Systemic medications, we've gone through that. Comparative, what we're doing is comparing. So with this, there's no side effects. The patient can't feel anything. The only thing you may feel is just a slight tingle. I'm not quite sure exactly why. Sorry, I'm yelling probably. Why that is, might stimulate nerves in the toe or whatever, but you can't feel anything really, so it's perfectly harmless. And there's no side effects, obviously. Systemic medications, as we do, particularly the liver seems to be the organ that can be affected in some people. And surgery, of course, there is no, in comparison, there's no pain, there's no anaesthetic, no risk of infection, and no downtime with this. They come in and they pop their foot in there for 12 minutes. If they're doing bilateral, they pop the other foot in there for 12 minutes. You go away and do whatever you want. And other than the first consultation, which we'll talk about, and that's the advantages. It's an unattended procedure. Would that be something that you would find attractive, do you think? Obviously you're going to talk to your patient, you don't just run in and say, stick your foot in there and run out. You talk to them, you do your initial, we do some, encourage debridement, things like that. But after that, they just leave their foot in there, and it turns off at 12 minutes. So it's not like you have to keep an eye on it. And then eventually, if you had, if there's a couple of you in the practice, you can combine it, you can use it together, etc. Yeah, heat causing, and the other thing too, the plume from burning. For those of you who use it, I don't know, you probably wear a mask, but the plume is sometimes can be quite dangerous. And in the operating theatre, again, I'm not sure if you're familiar with it. But a lot of the surgery now, when you're cutting bone and diatherming and things like that, there's always a plume of burnt tissue coming up, and you can see it in the light. And that used to be very common. Yes, I am old, and it was just after the war that I was actually in theatre. But now they've actually got suckers that suck fluid, and they also tend to suck these plumes away, because but there are a number of studies that shown it's quite dangerous for the surgeons and the scrub nurse and that to inhale, and the anaesthetist even who sits behind. So that's one thing. Generate heat, which we don't. Thermal lasers, until they're eradicated, the Luna helps eradicate spores and regenerate tissue, so it works a different way. Now, why should you contemplate it? I suppose they're quite an expensive piece of equipment. $49,950 for the standard, that's the standard price for it. So you say, well, that's expensive, yeah. So one, there's no known side effects, and I think that's pretty important. It treats a variety of diseases. Obviously, major hallux is the main one, but other nails can be treated as well. You can treat theoretically, and I won't put, but you can treat fingernails and things as well. It has good results. 90% in there's various clinical studies, and in this pack there's some more information on that. It's easy to use. Now theoretically, again, once you've seen the patient the first time and you've done your initial debridement and cleaned it up and given the first treatment, then maybe you could see them briefly for the second treatment and get, someone else, a girl at the front desk or whatever, but you can actually just pop it in there or just leave them and just say when you finish, go out, So there's that. 12 minutes to cycle. It's painless. There's no consumables, so there's nothing you have to pay for extra. I think with the hot lasers you do. There's consumable for, and as I was saying, perhaps it's going to introduce new patients to your clinics. Perhaps people are going to say, look, we want that laser. Heard about that cold laser, or do you do lasers? Yeah, hot or cold, whatever. Maybe they're going to start coming in. I think with the experience that I've had with this, that may well be, something to contemplate for the future. Okay. Oops. So how do you treat? Now the patients will come in, and depending on the extent of the toenail, and again you can sort of divide it into thirds, perhaps a third of the nail, 60%, 2/3 and the whole nail affected. Obviously the surrounding soft tissue can be affected as well with the spores. So that's something to think about. But depending on their severity, you can then contemplate what you're going to do. So the standard, and this is again from Martine Abrams in London, this is what she does routinely, 4 12-minute sessions weekly, and that follows a debridement. Now, do you debride these nails generally? Yeah. And you know how to debride. You've got drills or burrs or whatever, or scalpels, whatever. So you want to debride. And Sullivan, who's an Irish guy who's in that folder, which we'll go through, he says debride it a lot and get rid of it all, because obviously it's sitting there, and whilst the laser will go through it, it won't be as effective initially, and then it starts to grow back. So so the patient, so 4 12-minutes, you may need more. You might need up to perhaps 6 or 10 even over a period of time. So you might do the first 4 weekly, and then say we'll come back in a month, or come back in over 12 months, depending on how severe it is, and you're much more. Right, and these are just some case studies. Obviously, they always put the best ones up, so, but this is just the one she's put up. 55-year-old male, borderline diabetic, hasn't had any medication, no allergies, and 10-year history. And I'm sure you've seen all these patients who've had them for years and years and years. But has no other medication, but has been on a 6-month course of systemic medication. And 4 Lunula treatments, that's how it started. And that's 6 weeks after the first treatment. Now, first treatment is 4 treatments. That's weekly. So after the first month, and that 6 weeks after, as a result. Female, young female, good health, no allergies. 2-month history, so of the right fingernail. This is what, due to shellac nails. Now, ladies would know about that. I know nothing about it, but anyway, they can. And perhaps even for these clinics that do nails, both fingernails and toenails, you may start to see more of these. No previous treatments, 2 Lunula treatments, and that's 5 months after the first treatments. So the way she's got it, I think that would be 8 sessions altogether. Okay. So 1 treatment is 4 sessions. My understanding of this. So 5 months after, so that's the result. Case study 3, 38. She's got a thyroid condition, doesn't say what, hyper or hypo, probably hypo. She's on thyroxine, so it'd be a hypo condition, hypothyroidism. 6 monthly on both, so bilateral, and no treatment of sorts. So from there to there, and you can see. Getting there, guys. 25, young male. Is it more common in females? I think it's greater than 50%, certainly, isn't it? I think it's 60-40 or 70-30. So a young guy with this 6 monthly history of Candida albicans, and thus it's white. I'm sure people are familiar with Candida. previous topical ointments vary, didn't obviously work because it just can't penetrate. A lot of these things can't penetrate, obviously. And three treatments later and 6 months, and it's cleared up. And then why buy? And this is the selling bit. I'm not going to try and push you guys because I make a living, and if I don't sell one, I don't know. But they have a good learning modules. So if you do buy one with a Coney, you can actually go to them regularly. Okay, and this is just an example of the learning modules. How you can, and this is the demonstration of how it works, which will be much better. As you can see, it covers the 5 toenails, and even if you've got it in soft tissue, it will cover that as well. Types, I mean, you're familiar with that. So you can go there and get all the information. There is blogs as well. Martin Abrahams, in fact, actually gets onto the blogs from time to time. So if you've got any questions for the experts, you can. And the market potential. So the market need, that's the first thing. Now you're all familiar with the need or the possible need. The audience, okay, how many customers have you got, or clients, customers, what do you call them, patients? Or patients is out, isn't it? Is it clients? The competition. So there's no competition specifically for this, but there are obviously other options or other lasers. And it stands apart because it's unique. Pricing is what the pricing per patient, obviously, is what the consumers are prepared to pay. I was speaking to a podiatrist who's actually in English registration, and interestingly, she said to me, I said, I've got this laser. She said, it's only 50 grand, you're on the, she said, my patients barely can afford to pay me, so I don't think I'll be buying one. Interestingly enough, for the English amongst you, she said she had insurance and she was a member of the UK, and since Brexit, it's been cancelled. So she never joined the society here. You'll get some more members because they've lost their insurance. So I'm not familiar, it's British amongst you, but now this is just an example. It means not. I know there are clinics which, for the hot lasers, last I heard, were charging $275 a session, I believe. But I think 150, I know what you guys think, but is that a reasonable price? So $600 over 4 weeks for patients. I guess if you 150 a time. Now this is build up. You're not going to get 15 patients in the first month, obviously, but over 6 months, if you believe you can get 15 patients, so that's 60 sessions within 6 months, I'd say. Financing, if you did finance the whole thing, it's about $1,000 a month. Marketing, and again, you'll know about your own marketing, but these are just various arbitrary figures. And this is a lovely annual return of 80,000. So I'm sure if you could do that, you'd all be lining up to buy one. But but this is just an example. So and you'll know exactly what. And that's go back. That's how you build it up over 6 months. So okay, it's far more practitioner friendly. Decreased appointment duration. Okay, after the first one. The first one, if you're going to debride, you might need an hour maybe, and then after that, your routine would be less than half an hour probably. It's very little space in the clinic. It's transportable. It's got a nice handle here. And you'd probably have a carry pack like I've got out there. You could, if you've got a number of practices you practice from, you could move it around, put it in the car. When I transported on its own, I put a seat belt around it basically. Put it in the front seat and have a seat belt. Yeah, doesn't matter if I get killed, but you can't kill that thing. It's patient friendly, and your patients really like it in terms of, it's very simple and it doesn't hurt. And it does treat a number of other conditions. Okay, improved circulation. So Karen, we're talking, maybe the diabetic clinic, it may be...
Do you have to have it calibrated?
No, you have to have nothing done to it. The only thing you don't do, and the only one they hardly ever have a problem with them, somebody actually dropped one out of the back of a car, and it knocked the 2 lasers out. So obviously, If you just put it in your clinic and leave it there, you're never going to have a problem with it. They've virtually had... Sorry? No, they're guaranteed for 2 years. No, they go for ages. I guess eventually they're guaranteed for 2 years, but we've had them here for probably 7 years and they haven't worn out, no. So, yes. No, not really, no. Just not, obviously don't put your head and look at it directly, but it's on the floor, so no. It's a low, no, there's no contraindications that I'm aware of.
Just reading the list of contraindications, but there's a very large list of exclusion criteria.
Yeah, there is some exclusions. What have we got there?
Those are some of the things that it's purported to be able to treat. So, can you?
You can anything you want particularly. These are, it's not saying across the board you can treat every one of them, but
Well,
yeah, what's it got there?
Some of the things are, that they haven't been using oral medication, antifungal medication 3 months prior. So they're not having nail lacquers 3 months prior. That they will stay off nail cosmetics. Surgical pins and plates below the knee. So, some of these are things that patients might have.
No, I don't understand that. I don't. May say it, but there would be no indication.
Uncontrolled diabetes alone. So,
Yeah. Diabetes.
Sits with your patients that have diabetic ulcers.
Yeah, patients wouldn't come to you with diabetes for this treatment. It's not to treat diabetes per se. They may come to you with a fungal toenail, and they may be diabetic or borderline type 2, type 1 diabetic or whatever. But it's not to treat. I think what they're saying, don't treat. You're not there to treat diabetic ulcers or diabetes with it. That's what it means.
Oh, I thought it meant excluding them from,
from use.
positive response.
No, it's not. No.
Towards,
Sorry about that. That's
I'm just reading through it.
Is that Sullivan? That Sullivan paper? I think it is. Yeah.
Yeah, it is.
Yeah.
It is.
That's kind of an old one he's been doing. There's no reason you couldn't do it with implants below the knee, knee replacement.
Just for clarification.
Yeah, no, that's cool. Any questions you've got, we can. There's no reason. Even foot and ankle bunions, they have metal screws in there. It doesn't penetrate that far. It's not going to reflect. It, just basically treat. So, in summary, anyway, let's. In summary, I think the two things you've got to consider are, one, obviously it's an expensive piece of equipment. And you say to yourself, well, is it going to be worthwhile? And two, are you going to be able to pay it off and make some money from it? Obviously, those two things. And that's fair enough. One thing to consider at the moment, and check with your accountants, but the federal government are still offering for small businesses a tax credit. I think it's up to $150,000. So if you bought this, for example, in this financial year, that is immediate tax credit off your current year's tax return. Okay. So if you owed $50,000 in income tax for this year, when your accounts were done, this would offset that. So that's just something to keep in mind. It may or may not be an attractive, but whether it keeps going on, I don't know. It was $25,000 some years ago, and that's actually, I believe, and don't quote me, but I think it's $150,000 for small businesses, up to $150,000. So you could, if you had 3 clinics and you wanted to buy 3, that would be covered. So it's an immediate tax deduction, tax credit, I believe they call it. But you'd have to check with your accountant. Exactly. So you can actually buy one of these. Reha Care actually can arrange finance if you are interested. You can do your own finance, of course. That's up to you. But they do have, and the guy deals with them all the time. So it's around the $1,000 a month. So and there's no upkeep. And basically, I guess you've got to say, well, can I get the customers? Can I get the clients in? And how many can I build it up to? How am I going to advertise it? How am I going to market it? All those things. And of course, you're experts at that. You run your own practices and things. But some of the big practices like My Foot Doc and some other groups of podiatrists over east, they actually keep buying them. So they obviously work. So yes.
mentioned that it works on traumatised nails and psoriatic nails. You mentioned that you can use it on psoriatic nails and traumatised nails. What effect does it have?
Well, sorry, again, I think it's just increasing blood flow.
Does it improve the nail? Is there evidence?
Well, they've had quite a lot of experience with it. Sorry, it may or may not work. I don't think there's a guarantee it'll work on it. But it's something you could, if you have patients who come in, they have psoriasis, they have nail problems, you could certainly, try it. There are a number of papers which, if anybody specifically wants something like that, for example, I can get them for you, get some information. I haven't got them with me. Now, just lastly, with the other thing, one of the other things we do sell is Sterishoe, ultraviolet, and if you did buy a unit, I think you get about 6 of these free, and they retail for $150 or something. And one of the things you can do certainly, so this sterilises shoes. So the patient's got grotty shoes, full of fungus, and you treat them. That's great, and then they put the foot back in the shoe, and obviously they can reinfect themselves. So one of the things you can do whilst they're being treated is place the shoes in this. And again, ultraviolet, it does work quite well, and you can actually help. And you can sell them, of course, as well. But if you just want, it's just a little added incentive. You can say, look, your shoes may not be good, clean socks and all that. So you can give them all that advice. This is something you can do at the same time. So sit there and say, look, whilst we're treating your toenails, we'll also treat your shoes. No? Oh, that's good. Patients kind of like that sort of stuff. So it's only a little thing, but you do get some of these, if you purchase. And lastly, if we can, you've got your packs there. You just open your packs quickly. Now, whilst we're doing this, would somebody like to, or if you like to come and try it? Now, I'll show you how easy it is. Even I can do it, and I've got a very small brain, trust me. So you've got a key, and you've got 2 keys, so you don't lose them. Turn it on. Takes a few seconds to boot up. If we could get it shared. Is there any volunteers who'd like their rotting toenails fixed? You don't have to sit for 12 minutes, trust me. You can just have a feel of it. So if anybody wants to, whilst we're talking, please. Just wait till you. Anybody? Come on, just come and have a feel. Any ladies got sandals on or something? Yeah, we have a volunteers. Right, so basically you turn it on, it boots up, it initialises, and then it says press to start. You've got to think. Press to start. It goes for 12 minutes if you don't touch it, and turns it so it's a little audible ping. And if you want to pause it for any reason, there's one you press on this one. Now I can't actually. Let me start it. So I'll do it like this. So just for, I'm sorry. I'll just so you can see it. Sorry, I unplugged it because I'm a stupid boy. I'll just show you. You can actually see it, and then we'll pop it on the floor. Press to begin now. Press to start. Now if you can see it, there's 2 rotating lasers, the different colours we described, and you can see they're culminated and they rotate. So that's why it covers the entire foot. Okay, so it's not just in one spot. Okay, can you all see that? I'll turn it off now. I'll pause it. Just do this sort of thing. It's covered. The big toe is the one, and that's it. Just stay there a couple of minutes. And just in the last couple of minutes, I can bore you some more. So just some information on steri shoe, fungal toenail infection. Yes, certainly. Quiet, guys. Sorry.
As the person sitting there, is it important that they stay still?
No. Oh, you know, to keep their foot so they don't keep pulling it out. No. Very simple. You just sit there with your iPad and...
Moving it, will there be less effectiveness if the laser...
No, I don't think so. The laser's still going, no. You wouldn't encourage them to move it. There wouldn't be any need to move it, would there? Can you feel anything? Sometimes, as I said, I've used it a few times just to practice. The only thing you can feel is a slight tingle. It's not pain, it's just not always, but just sometimes. But otherwise, there's no pain, there's no feeling. So that's...
Sorry, was the treatment once a week? The treatment
Yeah,
cycle?
initially once a week.
Once a week?
And then
or
perhaps, so 4 weeks.
Is
Once a week
once
for 4 weeks.
yeah.
And then, depending on the result after 4 weeks, maybe you say, we'll come back in 3 months or once a month, you know, or once every 2 weeks. It's kind of up to you.
And is there any research have they discovered actually for how long you have that effect of increased blood flow and increased cells?
Well, once you treat it, if you treat it and you get a result, that should be it really, unless it can be reinfected, obviously.
Yeah, that basically that's where I'm going is, you know, can you reinfect within a month or after a month you can easily?
I guess you can reinfect any time, real likely if you pop your foot in shoes. But assuming you get a good result after, you know, say 3 months, and you've taught them, you've educated them about how to treat the foot, no, you shouldn't. There's no guarantee people won't reinfect the foot.
So it's safe to assume that probably the effect of the treatment after 12 minutes probably lasts a few hours, and then it just will wear off.
Oh, well, it's a cumulative effect, obviously. Yeah. Now, just the one that we were mentioning, this guy, this one, Robert Sullivan, just out of interest, he's the head of the, in Wales, no, so Ireland, head, and they've got 80, I think a captive audience of 80,000 patients, so it's an NHS, and he's done studies on 800 toes. This is one particular study, and the success rate was 89%. And he's done subsequent studies to that. So, and he's available. You can see his videos and all that sort of stuff as well. So they're kind of worth. And there's an abstract in there, and there's just a bit of other stuff with some other stuff we do. So. All right. Are you happy? Not bothering you? Does anybody else want to pop there? Sorry. Well, those case studies, that's all I can say.
So if you're thinking about whether to do a follow-up, so you're saying some patients require a follow-up.
Yeah, everybody's different. And some might need 12 months treatment.
How do you define whether your first treatment needs a second treatment or whether you leave it?
Sure, I know what you're saying. You can't see. You can't see the nails right here after you've debrided it. Sure. I'd have to refer to Martine Abrams, I guess. She's the expert, or one of the people who uses it. That's a good question. I don't have a specific answer for that. But yeah, I'll get your name. Would anybody else like to? Afternoon tea is ready. So if anybody wants to pop their foot in on the way out, or should I take it? Karen, should I take it outside? That'd be easier. And then we'll try. Look, guys, anybody who wants to try it or wants to have a chat, I'll be outside. Thank you very much. I don't know how that
first video cut.
Yeah, I'm not too sure. Sorry about that.
That's all right.
Thanks once again, Colin. We're going to have a quick afternoon tea, so that'll be for about half an hour, so we'll come back at 3:30. So.